Western Mass News is your vaccine authority, getting you answers after the single-dose Johnson & Johnson COVID vaccine ordered to stop temporarily here in the U.S., including here in Massachusetts. Good Tuesday evening, everyone. Thanks for joining us. I'm Chris Pisano.
And I'm Jordan Jaglinzer. The pause was announced this morning following reports of 6 people developing blood clots. Western Mass News has live team coverage for you this evening. Western Mass News reporter Leon Purvis is standing by, but first we begin with Audrey Russo, who's live for us in Holyoke. Audrey, what can you tell us?
Well, the signs went up pretty quickly on the doors of this Holyoke vaccine clinic, canceling it for the day. They were set to give the single-dose Johnson & Johnson vaccine, and now federal investigators with the FDA and officials with the CDC say it could take several days before this pause on that vaccine is brought to an end.
So I can get the vaccine because my job is required.
Brian Rodriguez tells Western Mass News he had just finished filling out the information required to get the Johnson & Johnson vaccine from a Canal Street clinic in Holyoke when he got a phone call saying it was canceled.
I was a little bit surprised, a little bit sad at the same time, because I just want to get it done and over with.
That clinic, run by Behavioral Health Network, one of thousands halted across the state after the Food and Drug Administration and the Centers for Disease Control recommended pausing that COVID-19 vaccine after 6 women developed blood clots. The Behavioral Health Network issued a statement on their website saying in part, quote, "Out of an abundance of caution, we are pausing the administration of the Johnson & Johnson vaccine pending additional guidance from the Department of Public Health. At this time, we do not have additional clinics scheduled in Holyoke." Federal health officials say more than 6.8 million doses of the Johnson & Johnson vaccine have been administered in the country, and only 6 U.S. cases of clots have been discovered. State health officials say none are known to be linked to Massachusetts. But what if you already received the 1-dose shot and are worried? Dr. Armando Paez with Bay State Health says there are a few symptoms to look out for.
If you have received J&J vaccine within 3 weeks of this, developing symptoms of headache, abdominal pain or leg pain or shortness of breath, you should contact your healthcare provider.
But if you feel fine, he says there's no protocol being issued to take any type of medication like aspirin.
At this time, we don't have any specific recommendations.
UMass Amherst microbiologist Erica Hamilton weighing in. She says the vaccine was tested on both women and men.
If there is an extraordinarily rare side effect, it's not going to appear during the regular clinical trials.
But even then, she says that federal health officials still need to investigate whether the vaccine was actually linked to the clots, as the women may have had other health conditions in common.
If you look at the things that all 6 of them did, you're going to find a lot of overlap.
Coming up on Western Mass News at 6, what we know these 6 cases have in common and some of the factors that Hamilton says those with the FDA and CDC should be looking into when it comes to determining whether or not these blood clotting cases are in fact related to the vaccine. Live in Holyoke, Audrey Russo for Western Mass News.